Welcome to Magellan Healthcare NIA RadMD demonstration. Today you'll be learning how to start the authorizations through our website, www.radmd.com. After you've obtained your user ID and password, you can go to RadMD and you'll be logging in. You will be typing in your account ID, which is your user ID, as well as your password. You will then get a security disclaimer. Please read that, and you can click on OK. This will bring you then to our RadMD menu page, where you can ask to request an exam. You could search the status, and you can also check out our health plan specific educational documents. You may click on request an exam. It will tell you the elements that are needed for the prior authorization process, and click on continue. You will then put in the patient's last name, first name, date of birth, and select the health plan that's associated with that member. You do not have to put the member ID in. That is optional. And you're going to save and continue and go to step 2. This is where you're going to select the ordering physician. You could put first name, last name, or their tax ID in and click on search. You do not have to fill all these boxes out. You put in Dr. Welby's name, click on search, and it will bring you to the list of physicians. Now, Dr. Welby is the only one on that list. You do just click on the name of the physician, and it'll bring you to identifying the exam. With this, you would be choosing the exam that you are asking for. You could either click on the name, add, and it goes into that box. If you're not quite sure and you need to do a keyword or a CPT lookup, we do have that capability. You would click on the link. You could either search by keyword or by CPT4. It will bring you a list of the exams. Choose the appropriate one. It will bring that over into the box. If it is the wrong one, you just highlight it, click on remove, and you will continue to the next step. Here's where you'll be choosing the rendering provider. You can put in the name, city, zip. Again, you don't have to fill out all those boxes, but if you do put in the name and they have a couple different locations, you may want to put the zip code in. Click on search, find the rendering provider, click on their name, and it will bring you to the reason for the exam. Just like the CPT4, you will have to put in an ICD-10 code. We do also have a link there for help where you could either search by the code or again by the keyword. So we are going to search by the code, and we'll bring you up a list. You click on the appropriate code and brings you then to your next question, which a brief reason for the exam. We just ask that you do not fill out the patient's medical history in here. Then it'll ask you some questions. Is it a motor vehicle accident? Is a third party financially responsible or due to workman's comp? You may also put in the date of service if you know it, but you do not need that. And you're going to save and go to your confirmation. Confirmation page is going to ask you for your phone number, who we need to ask for if we need to contact you or your office, the fax number, and again, we'll ask you just to reaffirm the fax number. You can go paperless, which means you're receiving everything electronically. If not, and you want to go to stay with your paper, you just click on yes. Your confirmation page will give you all the answers to the questions that you have put in there, and you can just review that. If that's correct, you can go to click continue and to the clinical questions. We will ask you, based on what you've chosen, these clinical questions, so it will go through an algorithm. And you just continue to answer the questions, and you will notice that on the bottom of the questions, it is putting the answers that you replied to previously. So we will continue on with the clinical questions. and answer to the best of your ability and what is in the patient's records. Now, this request has pended for clinical review. On this page, you can print what you've had, and you can also print the fax cover sheet if you're going to fax the records to us, but it will also show you the status, which is pending, and the tracking number as well. Now, on the bottom of this page, you will see you can start a new request, or the best of all, you can upload clinical documentation. Uploading clinical documentation is no harder than sending an email like you currently do and attaching a file to it. So you'll get to the page, you'll go here, you can click to browse your files, click on the document that needs to be uploaded, and you'll get, you have successfully updated the following to the NIA site. Now let's see what an approved request looks like. The approved request will just have the print button there. You would just click on that. It will tell you it's approved, the validity period, and as well as the authorization number. So you could print this file for your records as well. Now you have the option to go and request another exam or go back to the main menu. This concludes our demonstration.